Have you ever taken a medication, felt a little off, and wondered if it was just age catching up with you? A patient of mine once shared that she felt a strange pressure in her head every afternoon after taking a pill she'd used for years. She assumed it was nothing until the day her blood pressure shot so high she had to be rushed to the hospital. I want you to imagine this for a moment. Picture the medications sitting on your kitchen counter, the same ones you take every morning without question. Now imagine that one of them, or even the combination of them, is quietly increasing your stroke risk without giving you a clear warning. Many seniors believe their medications protect them, and often they do, but very few know that certain daily pills can dramatically raise stroke risk. Stroke risk doesn't come only from disease or genetics. Sometimes it comes from overlooked side effects that build slowly inside the body, and the medications that cause the most trouble are often the ones people have been taking for years, the ones they trust the most. As we get older, medications affect the body differently. Our metabolism slows down, meaning drugs stay in the system longer. Kidneys and liver process them less efficiently. Blood vessels become more sensitive. Even a small dose can have a stronger effect at age 70 than it did at age 40. A pill that once helped can become risky when combined with other prescriptions or taken for too many years. Dehydration, changes in nutrition, and slower circulation add another layer of vulnerability. And because so many seniors dismiss early symptoms as just aging, the warning signs often go unnoticed. I've seen this countless times in my practice. A patient starts a common pain reliever, and suddenly their blood pressure spikes. Another adds a cold medication and begins feeling lightheaded for days. Sometimes it's not a dramatic reaction, but a gradual shift in how the blood moves, how the vessels respond, or how easily clotting occurs. These small changes matter. In this video, we're going to explore which medications can raise stroke risk, the symptoms you should never ignore, and why these dangers are rarely discussed openly. I invite you to stay with me, learn with me, and take a step toward protecting your health. And if you find this helpful, I'd be grateful if you subscribe so we can continue this journey together on Senior Health Daily. How medications increase stroke risk in seniors. As we move into this deeper part of our conversation, I want to invite you to sit with me for a moment and think about something we often overlook. Medications, even the ones we trust the most, are not passive passengers in our bodies. They are active ingredients moving through the bloodstream, influencing how your heart beats, how your blood flows, and how your brain receives oxygen. And as we age, the way these substances interact with our bodies changes more than most people realize. Many medications have side effects that seem small at first glance. A slight rise in blood pressure, a bit of fluid retention, a racing heartbeat, a day of dizziness. But for seniors, those little things become significant. They can disrupt circulation, thicken the blood, or interfere with the delicate rhythm that keeps the brain fully supplied with oxygen. Let me explain this in a simple way. Imagine your circulatory system as a series of highways. When medications increase blood pressure, it's like raising the speed limit on all roads at once. The heart pumps harder, the vessels become tense, and the pressure inside them grows. Over time, this constant push weakens the vessels and increases the chance that a blood clot may become lodged in the wrong place. Some medications also thicken the blood. When blood becomes thicker, it flows more slowly. Almost like honey instead of water, slow-moving blood is much more likely to clot. Even tiny clots, ones you would never feel, can travel and cause a sudden stroke without warning. Other medications affect the heart rhythm. When the heart rhythm becomes irregular, even briefly, blood can pool inside the chambers of the heart, and blood that pools begins to clot. One small clot can travel upward and block blood flow to the brain. Here's what makes things more complicated for seniors. The body metabolizes medications more slowly with age. This means the same dose that once felt normal might now stay in your system longer, hit harder, and interact differently with the rest of your prescriptions. Your kidneys and liver don't clear drugs as quickly. Your blood vessels are more sensitive. Your circulation is slower. A medication that was safe years ago may not be safe today. Inflammation is another quiet trigger. Some medications, especially those taken long-term, can increase inflammatory markers in the bloodstream. Inflammation makes blood vessels less flexible, more irritated, and more vulnerable to damage. A stiffened vessel is much more likely to develop a blockage. All of this becomes even more dangerous when medications interact with common age-related issues. Dehydration, for example, thickens the blood dramatically. A person who forgets to drink water, combined with a medication that raises blood pressure, can unknowingly push their stroke risk much higher. Low potassium, often caused by diuretics or poor diet, can lead to heart rhythm problems. Poor sleep, which many seniors struggle with, raises cortisol and disrupts the body's balance. And perhaps the most important truth is this. Many older adults think dizziness, blurred vision, or lightheadedness is simply old age. But often, these are early signs that a medication is altering blood flow or affecting the heart in ways that raise stroke risk. I've had countless patients dismiss symptoms that were actually their body's way of asking for help. This is why understanding how medications increase stroke risk is essential. Not to create fear, but to create awareness. When you know what's happening inside your body, you can protect yourself with clarity and confidence. Categories of medications most associated with higher stroke risk. Now let's talk about the types of medications that tend to raise stroke risk the most in seniors. I won't mention brand names because that isn't helpful or medically safe. What matters is understanding the categories, the patterns, and the reasons these drugs can create danger. One major category is certain blood pressure medications. This sounds surprising, doesn't it? After all, blood pressure medicine is supposed to help, and often it does. But some types can cause sudden drops or surges in blood pressure, especially when seniors stand up quickly, forget a meal, or become dehydrated. Those sudden changes can strain the vessels in the brain. I've seen patients faint or grow extremely lightheaded because their medication was too strong for their current age and health. Pain relievers, especially NSAIDs like ibuprofen or naproxen, are another high-risk group. These medications can raise blood pressure and put stress on the kidneys. When the kidneys strain, the body retains more fluid and blood pressure climbs higher. A patient may feel fine while taking them, but silently build up stroke risk over weeks or months. Hormonal medications, such as certain estrogen therapies, increase the likelihood of blood clot formation. These medications influence the chemistry of the blood itself, making it more prone to clot. A single clot in the wrong place can create a stroke almost instantly. Decongestants are another surprising danger. These drugs constrict blood vessels to provide relief from congestion. But constricted vessels mean restricted blood flow. For seniors with already narrowed arteries, this added pressure can be dangerous. Sleep medications and anti-anxiety drugs slow breathing and reduce oxygen levels. Over time, reduced oxygenation weakens the brain's resilience. A brain that isn't properly oxygenated becomes more vulnerable to any slight blockage. Some antidepressants alter sodium levels, clotting factors, or blood pressure. They may be extremely helpful for mental health, but they require careful monitoring to keep the body's chemistry balanced. Steroid medications, often used to treat inflammation, can raise blood pressure, increase blood sugar, and weaken blood vessel walls when used long-term. These changes add up and make the body more vulnerable to stroke. Finally, medications that cause dehydration are a significant concern. Dehydration thickens the blood, increases clotting, and reduces blood volume. Combined with any medication affecting blood pressure, dehydration becomes dangerous. Each of these categories matters even more for seniors because aging arteries are more fragile. The brain becomes less tolerant of oxygen changes, and multiple medications increase the chance of unintended interactions. The goal here isn't to scare you. It's to empower you with knowledge so you can speak confidently with your doctor about your medications and understand what might be affecting your health behind the scenes, drug interactions, and hidden triggers. After 60. As we get older, it's not just the medications themselves that increase stroke risk. It's the way they interact with our daily habits. Small routines that feel harmless can create dangerous combinations when paired with certain drugs. One of the biggest hidden triggers is not drinking enough water. Seniors often drink far less water than they should. Sometimes they avoid water because they don't want to use the bathroom too often. Sometimes they simply forget. But dehydration thickens the blood dramatically. When you combine dehydration with a medication that raises blood pressure or influences clotting, stroke risk rises steeply. Another common issue is taking multiple pills in the morning and evening. Many seniors have at least 6 or 7 medications, and the interactions between them aren't always predictable. Some amplify each other's effects. Others cancel each other out. Some slow the metabolism so much that levels build up dangerously in the bloodstream. A frequent hidden trigger is using over-the-counter medications without telling a doctor. Cold medicines, allergy pills, herbal products, and pain relievers can interact with prescription drugs in ways that dramatically affect blood pressure or heart rhythm. I've seen this more times than I can count. Changing brands, adjusting dosages on your own, or altering the timing of doses can also create problems. Many seniors don't realize that generic versions, while effective, may not act exactly the same way as their usual brand. Even taking a pill an hour earlier or later can shift how the body absorbs it. Diet also plays a role. Eating high-sodium foods can counteract blood pressure medications. Drinking alcohol with certain prescriptions can cause blood pressure spikes, irregular heartbeats, or oxygen drops. These triggers don't need to be dramatic to cause harm. Stroke risk increases gradually but significantly as these patterns repeat day after day. Let me share a story. I once treated a patient who had been taking a common anti-inflammatory drug for her arthritis. She didn't think much of the dizziness she felt each afternoon until one day her daughter found her slumped over, unconscious. Her blood pressure had risen to a dangerously high level because the pain reliever was interacting with her blood pressure medication. She thought she was just tired from gardening. She never imagined her medication routine was creating a storm in her bloodstream. Another patient mixed an over-the-counter cold medicine with her heart medication. She didn't know the cold medicine constricted blood vessels. Within days, she felt chest tightness and confusion. Her stroke risk skyrocketed without her realizing it. These stories are not unusual. They're reminders that medications don't exist in isolation. They interact with your foods, your drinks, your habits, your other medications, and the way your body changes with age. Understanding these hidden triggers gives you the power to make safer decisions and protect your brain and heart more effectively. Early warning signs of medication induce stroke risk. Now that we've talked about the medications and their triggers, let's talk about the body's early warning signs. These signs are subtle and easy to dismiss, but they are your body's way of saying something isn't right. New dizziness, confusion, or trouble concentrating is often the first sign. Many seniors blame these symptoms on fatigue or age, but they're often linked to changes in blood flow caused by medications. Irregular heartbeat or sudden waves of fatigue can signal that a medication is affecting your heart rhythm. Even a small change in how your heart beats can increase stroke risk significantly. Blurred vision or brief numbness in the face, arms, or legs should never be ignored. These are signs the brain may not be receiving consistent blood flow. Increased irritability or emotional shifts are also signs. People often don't realize that emotional changes can come from medication affecting brain chemistry, oxygenation, or blood pressure. Frequent headaches or pressure behind the eyes can indicate rising blood pressure. Worsening balance or coordination issues may be a sign of reduced blood flow to certain areas of the brain. Difficulty sleeping or sudden nighttime awakenings can signal that medications are affecting brain oxygenation or heart rhythm. None of these symptoms mean you're imagining things or being dramatic. They are real physical signs that your body is under stress. They are signals that deserve attention. They are not just aging. They are opportunities to prevent a stroke before it happens. Why doctors rarely mention these risks? You might wonder, if these risks are so real, why don't doctors talk about them more often? The truth is complicated. Medical training focuses heavily on treating primary conditions. Doctors are taught to control blood pressure, manage diabetes, regulate cholesterol, and address immediate symptoms. Long-term medication side effects don't always get the same emphasis. Doctors also assume patients will report symptoms. Seniors often say they feel fine, even when they're experiencing problems. Many older adults grew up believing they shouldn't complain or ask too many questions. Appointment times are short. It's difficult to go through a patient's full medication list and explain every potential interaction in a 10-minute visit. Doctors also assume pharmacists will catch dangerous combinations, but pharmacists don't always know what over-the-counter medications or supplements a senior is using at home. None of this means doctors don't care. It simply means the system isn't designed perfectly. That's why emotional and physical awareness is a form of preventive medicine. The more you understand how your body responds to medications, the more power you have to protect your health. What seniors can do today to stay safe. The good news is that you don't need to overhaul your life or give up your medications. You simply need awareness and action. Keeping a medication list and bringing it to every doctor visit helps your care team see the full picture. Asking once a year whether you still need each medication can prevent unnecessary risks. Drinking enough water each day protects your blood flow and keeps medications from becoming too concentrated. Never mixing over-the-counter products without checking interactions prevents dangerous surprises. Checking your blood pressure regularly, especially after starting a new medication, helps you catch early changes. If something feels off, tell someone. Report new symptoms immediately, even if they seem small. Your body rarely whispers without a reason. Gentle movement helps your circulation. A daily walk, stretching routine, or light activity can lower your stroke risk more than you might think. Seek help when something feels wrong. That one decision could save your life. Staying informed is the strongest form of self-protection, and staying connected to a community like Senior Health Daily can give you the clarity, confidence, and support you deserve. As we reach the end of our time together, I want to bring you back to something deeply important. Your body has carried you through decades of life. It has walked with you through triumphs and heartbreaks, through ordinary days and unforgettable moments. It has protected you far more than you realize. It deserves kindness, it deserves patience, and it deserves the careful attention that keeps you healthy and strong in the years ahead. Awareness is one of the most powerful tools you have. The moment you begin to understand how medications affect your body, your circulation, your heart rhythm, and your overall stability, you step into a place of protection and strength. Stroke risk isn't something you're helpless against. It responds to knowledge. It responds to action. It responds to your willingness to listen to the signals your body gives you, even the quiet ones. Medications can absolutely save lives, but they also require partnership. When you talk openly with your doctor, when you ask questions, when you trust your instincts, if something doesn't feel right, you become an active part of your own care team. That confidence is a form of healing. It builds safety. It builds clarity. And it builds a future where you stay in control of your health, rather than feeling uncertain or overwhelmed. I want you to believe in your own strength. You have the ability to stay informed, to speak up, and to protect your well-being. You're not too old to learn something new. You're not too late to make a change. Every small step you take today can shape a healthier tomorrow. And remember, you never have to walk this journey alone. Here with Senior Health Daily, you have a community that supports you, guides you, and values you. I'm grateful you spent this time with me, and I hope you'll stay connected so we can continue learning and growing together. Thank you for being here. Thank you for caring for your body and your future. And I look forward to seeing you in the next video.